All right, this is the fifth lecture in the series of the endocrine system about the posterior pituitary and the pineal glands. I'm going to talk about the two hormones that are being stored by the posterior pituitary gland, ADH, anti-diuretic hormone, and oxytocin. And then the other gland, the endocrine gland in the brain, is the pineal gland, um, responsible for sleep, from melatonin production. First question, true or false? The posterior pituitary makes ADH and oxytocin. True or false? This is from the previous lectures we've had about what the relationship of the posterior and anterior pituitary gland are in relation to the hypothalamus. And the answer is false. Remember the posterior pituitary gland depicted by this monkey sitting posterior to the captain only stores. So within the storage, he's only responsible for two things, oxytocin and anti-diuretic hormone. They're produced by these neurosecretory cells, travel through these axons within the stalk of the pituitary, also called the neurohypophyseal tract. And they're stored there, and it's when the hypothalamus tells the posterior pituitary to release them that they get into the bloodstream. So anti-diuretic hormone is responsible for keeping you from getting too dehydrated. So it senses dehydration. It also senses stress. So the body figures that if you're stressed, like a car accident, you may be losing blood. So the kidneys will retain water and the renal tubules will stop, will actually reabsorb water. So anti-diuretic hormone, anti means against, and diuresis means to pee. Oxytocin is responsible for contracting the uterus during childbirth. It's also released during orgasm and also breastfeeding. It is responsible for the letdown, for when the breast starts to release the stored milk. Anti-diuretic hormone, I mentioned, is affecting those distal tubules. So it stimulates water reabsorption back into the bloodstream before it's allowed to pee out. So an example, the first one is like the marathon runner who runs without drinking, gets really dehydrated. The other example is the bicycle is struck by a car and develop a femur fracture. ADH is released in both instances. How this relates to patient care. You're taking care of a patient in the recovery room following surgery for a fractured femur. Regardless of the blood loss and how much fluid replacement they got in surgery, what would you expect their urine output to be? Would that be high urine output or low urine output? The answer is low urine output because the ADH is being released, and so the urine output may not be as high as you would expect. Usually within 24 hours, you see patients start to diurese. So this is the scenario. The surgery patients under stress, this stress is noted by the thalamus. The hypothalamus responds by stimulating the posterior pituitary gland to release anti-diuretic hormone. And the result is reduced urine output. Let's go on to a disease presentation. Daffy Duck has a craniotomy for a brain tumor that was successfully removed. 2 weeks later, he presents with excessive thirst and urination. This this disease is called diabetes insipidus. It's a lack of anti-diuretic hormone that's being released, inability to concentrate urine, and eventually developing chronic dehydration. DI is the acronym. So diabetes insipidus means to pass through lacking taste. What would diabetes mellitus mean? The answer is passing through. And when it says pass through, so it's passing through the kidneys into the urine. It's either with diabetes insipidus, it's lacking taste. So it's so dilute, you don't taste any salts or anything. And in times past, actually, they did taste the urine. The medical providers, that was the only way they could tell if someone was diabetic or not. They could taste the urine and see if it was sweet. So diabetes mellitus, passing through sweet, all the excess glucose that the body is holding in the vascular space spills out into the urine. So they pass through sweet. Diabetes insipidus, there's no ADH, urine passes through very, very, very dilute. And so it doesn't have any of the normal, it would taste the salty taste. So ADH is being released by the posterior pituitary gland. And without that, the kidneys are not told to reabsorb water. So the next hormone, oxytocin, it's also stored in the posterior pituitary along with ADH. It is considered the love hormone, love potion number 9. It's contracting during childbirth. It releases breast milk. Oxytocin releases the breast milk, so that's the letdown. Prolactin is responsible for producing that breast milk, and oxytocin is for releasing. So you need both hormones for breastfeeding. So these are all released during physical contact, love, intercourse. It's the way of our bodies ensuring that we stay in groups, because survival is dependent upon staying within groups. All right, so early in the 90s, they did a study and found that breastfeeding women are calmer in the face of exercise and psychosocial stress than bottle feeding mothers. So oxytocin is a way of ensuring the propagation of the species and caring for the baby. So this is a quick film. What would life be like if men breastfed?
Oh, no, don't worry. It happens. Do you need to go pump?
Mr. Sanders, is there a problem?
No, no problem.
Because if there is a problem, please don't be afraid to ask for help. We all know how difficult the transition back to work can be. If there's anything that I can do personally to help make it smoother for you, let me know, all right?
All right, thanks.
Have you seen the lounge yet?
No, not yet.
Oh, Josh, give him the tour.
Oh no, Dave is in the cave. How's it flowing, my man?
This place is amazing.
Great to finally have you down here. What are you pumping? Ooh, Mercedes LS. I've heard about that one.
How's yours treating you?
Can't beat the eye pump. It's just so well designed. I mean, check out this magic.
Call me old school, but
but I just don't get those fancy motorized pumps. I mean, if you're gonna set time aside, you should get a workout in, right?
Yeah, that's great if you got all day. But this bad boy is guaranteed to pump in 5 minutes or less.
Are you all right?
Our wives have any idea how hard we have it?
No clue.
There's a reason men do this job. Oh, gee, sorry.
It's
I'm not
okay.
looking. I just,
What do you need?
Toner?
The middle shelf.
Here?
Lower?
Oh,
There you go.
Wow, that thing is loud. Oh, sorry.
So that's an advertisement for a breast pump. So what this shows is what happens with the act of breastfeeding, even thinking about breastfeeding. So what brain structure is receiving the input that in turn stimulates the release of oxytocin? Is it the hippocampus, the amygdala, or the thalamus? The answer is the thalamus. Remember, the thalamus is the one that's receiving special sensory input, but also thoughts. So the thalamus receives input through any of the 5 senses. So oxytocin is released, prolactin produces milk, and the result is lactation or production of breast milk. So is oxytocin regulated by positive or negative feedback loops? The answer is actually, that is wrong. Oxytocin is regulated by positive feedback loops. Okay, so it's a positive feedback loop, gets the job done, disruption, response, the job is finished. So now let's go on to the pineal gland. It's responsible for melatonin production, initiates the onset of sleep. It's a tiny endocrine gland in the back of the brain, still in the mammalian brain, just behind the thalamus. It was named after because it's shaped like a pine cone. So I insist on calling it the pineal gland, but other people will call it the pineal gland, which is also correct, of course. It responds to your circadian rhythms. So within the cadaveric specimen, it is right there. It's tiny, tiny. Okay, since everything in the body runs on circadian clocks, what synchronizes the pineal gland along with many of the other internal clocks? This is an introduction of a new brain structure. The answer is the suprachiasmatic nucleus. So there are multiple, just about every cell runs on a circadian rhythm. So all of these clocks get synchronized as the light hits that suprachiasmatic nucleus. But the point I bring this up is it not only synchronizes clocks, but without light, you can result in severe depression, behavior disturbances, and physical ailments. So for melatonin, it gets synchronized with light, but light actually inhibits, so that these images where light is hitting the suprachiasmatic nucleus, there's an inhibition of the pineal gland for releasing melatonin. When darkness falls, it activates melatonin production. Unfortunately, this reduces with aging, and so people as they age have more difficulty falling asleep. So melatonin initiates sleep, but it's not there to keep people asleep. back to circadian rhythms. There are certain times when you work better. Circadian rhythms, because of the biologic clocks, they found that your deepest sleep is around 2 a.m. Melatonin production stops at 7:30 a.m. Your highest alert is actually around 10 a.m. So if you want to take an exam, plan something that you are able to schedule that you need in a high alert, that should be around 10, 11 a.m. Your fastest reaction time is 2:30. And for a great workout, your greatest cardiovascular performance and muscle strength is at 5 p.m. Disease presentation. This is a very rare genetic disorder, fatal familial insomnia. Begins in adulthood. Like I said, it's only about 25 families worldwide. They don't know they have it until later in age. And then when they develop it, they're unable to sleep and they finally die 18 months, and there's absolutely no way to treat it. It points out that sleep is extremely important for health. Going on a little bit more about sleep, there are 5 stages of sleep, but the two most important to remember are the deep sleep and the REM sleep. And they're having their time multiple times during the night. These sleep stages, you don't stay in deep for a long time. You stay in and out, deep REM, deep REM. So this is showing some of the sleep stages. This is actually from my monitoring with my own ring. So deep sleep should be there about 20% of your time. It's marked by having your blood pressure drop. Your breathing becomes very regular. Normally when you're awake, your breathing is irregular. Sometimes you take a deeper breath and you lighter breath the next breath. But during deep sleep, the people are difficult to waken. It's your most restorative sleep. It's during that period that you get great muscle growth repair. And it's also that extremely important time when brain waste is cleaned up. So patients with dementia, the most important sleep that they need is this deep sleep. In contrast, REM sleep is about 25% of the sleep time. The breathing is shallow, irregular, so it's almost as if you're awake. But what happens is that for some reason the body gets paralyzed, and perhaps it's because you're going into this dream state, and if you weren't nearly paralyzed, you'd be kicking around, thrashing, and losing lots of energy. But there's still a lot of rapid eye movement going on. This is an extremely important period for memory consolidation, learning, creativity. So you keep replaying all the lessons you learned the day before, all the experiences that you've had. And notice that during REM sleep, as shown by this lighter blue, it's happening also throughout a lot of periods of sleep. And here it's shown that the REM sleep happened just before waking at 7 a.m. So if I had set my alarm for 5 a.m., I would have missed a substantial percentage of my REM sleep. So this is another recording I did. I actually recorded every night, actually. But I had my granddaughter for a sleepover. And this is what happens. You lose a significant amount of sleep during stress or sleeping in a different bed. And the deep sleep dropped to only 11 minutes, only 2%. So another couple of things to remember, melatonin produced by the pineal gland initiates sleep. And don't get that confused with another word called melanin, which is produced by melanocytes. It is present in the skin, determines the eye color. of your iris and your hair color. So in summary, posterior pituitary gland stores oxytocin and anti-diuretic hormone. They're storing only on command of the hypothalamus do they get released. The pineal gland produces melatonin, initiates sleep. It's controlled by the suprachiasmatic nucleus and light, keeping it synchronized. If you have lots of light before bedtime or anything but candlelight or moonlight, it will inhibit melatonin production. So, in summary, eat well, move daily, hydrate often, sleep lots, love your body, and repeat. And I put this in because, yes, I do calculate how much sleep I'm going to get. Any questions? Please leave comments and please subscribe to the channel. Thank you.